Hello, I'm Amini and I will be presenting this research titled Self-Perceived Health in Functionally Independent Elderly in Selangor, Associated Factors on behalf of my co-researchers from the School of Healthy Aging in UCSI University. The world's population is aging rapidly. In 2010, 5% of the Malaysian population were above 65 years old, a number that is predicted to nearly triple by 2040. Self-perceived health is a subjective assessment by an individual of their own overall health status. Multiple aspects of current and future health have been linked to SPH, including morbidity, functional health, and mortality, as well as healthcare utilization and medication intake. One of the most crucial determinants of the elderly's quality of life is their health status. SPH and aging affect self-efficacy, which in return motivates people to use effective coping mechanisms for maintaining their physical functioning. SPH is a reliable and valid measure related to functional decline. It has frequently been more effective for predicting help-seeking behaviors and utilization of health services. Poor self-rated health has been linked with increased morbidity and mortality among the elderly. However, there is limited information in Malaysia regarding SPH among the elderly and its association with socio-demographic factors. Considering the growth of the elderly population in the near future, the lack of information on different dimensions of elderly health may leave the healthcare system unprepared. The study aimed to assess SPH among the elderly in Selangor, as well as to determine the association between socio-demographic factors and level of SPH among the elderly in Selangor. This was a cross-sectional study with convenient sampling collected from public spaces in Selangor based on a set of inclusion criteria. Participants selected were 60 years old and above, and ethical approval was obtained from MREC. A minimum sample size of 163 participants was obtained from a relevant formula. The questionnaire consisted of 43 questions. The scoring system was used to assess SPH. The majority of participants were men, with their highest level of education being high school between the ages of 65 to 69, did not have an income and were getting family financial support and also had no insurance. The number of the uninsured at 51% was far higher than China at approximately 7% and the US at only 4%. Most participants rated themselves to be moderately healthy. 30% of the Malaysian elderly in this study perceived themselves to be unhealthy. In comparison, other studies found roughly 18% of the Spanish elderly, 24% of the Portuguese elderly, and 8.9% of the Singaporean elderly viewed themselves the same way. Differences in culture, education, and national healthcare systems may account for these contradictory results. Only 28% of respondents did not have a pet, nearly 80% were involved in religious activities, and 58% had visited a clinic 1 to 3 times in the past 6 months. The majority of the sample population could carry out personal chores and handle physical exertion with no limitations, but 52% were slightly limited in doing vigorous activities like carrying heavy objects. The most common medical checkup was for blood pressure and the least common was for bone density. Considering reports of the high frequency of hypertension and diabetes in Malaysia, these reports are consistent with our participants' annual checkups. Chronic hypertension, diabetes, and osteoarthritis or other joint disorders were the 3 most common diagnoses among the studied population. Adherence with taking medication on a regular basis ranged from 30% to 100% in the study. The reasons for this were not identified and thereby require attention. According to a 2016 study, good compliance with taking medication regularly decreased with age, and compliance ranged from 0 to approximately 56%. Another study conducted in Malaysia revealed 85 out of 154 elderly people did not comply with their medication. The factors associated with poor adherence were multimorbidity, cognitive impairment, complex regimens with multiple prescribing physicians, and problems with drug storage or formulation. Those in the 60 to 64 age group were more likely to perceive their physical health to be impaired, suffering from a considerably worse perception of their health. Older participants, however, seemed to have an improved self-perception, suggesting that SPH improves after 64. For all domains of physical health, women were more likely to have a negative perception of their health compared to their male counterparts. Men were significantly more positive in perceiving themselves as healthy. Unlike the findings of the 1998 Singaporean study, lack of financial resources was not associated with the SPH of the participants. This could be explained by the Malaysian healthcare system providing reasonable care to the elderly population. Also, healthcare is free for senior citizens. This study revealed that being insured is significantly linked to SPH among the elderly population in Selangor, Malaysia. This could possibly be due to feelings of security associated with having health insurance. To conclude, demographic factors including age and gender, having health insurance, living with other family members in a household, participating in religious activities, and perception of individual health compared to others were significantly associated with SPH among the elderly population in Selangor, Malaysia. The study found that a set of health, social, and demographic variables are strongly associated with SPH in functionally independent, community-dwelling elderly in Selangor. These findings demonstrate that SPH is multifaceted and highlight the need for a thorough assessment of SPH in the development of suitable health-related programs directed at promoting active, healthy aging that ultimately delays the onset of dependency. There were some limitations in this research. The study limitations were recruiting respondents only in Selangor and not recruiting homebound elderly or those having difficulties navigating public spaces. Some of the elderly did not understand Malay or English. Some of them only understood dialects, which made participation in this study impossible. Thus, the results cannot be generalized to the whole elderly population in Selangor or Malaysia. The results of this study should be taken into account when making plans for the improvement and maintenance of health in the expanding Malaysian elderly population. The information derived from SPH is useful for preparing the healthcare system in a timely manner by revising and amending healthcare policies, medical guidelines, insurance policies, and public health education campaigns. Since most of the patients treated in government hospitals are older adults and as subjective health and subjective physical complaints influence how often the elderly need medical consultations and healthcare services, SPH may help reduce unnecessary future referrals to hospitals and prevent practitioners overlooking essential medical screenings. The researchers would like to acknowledge the funding agencies of this study. These are some of the cited references. Thank you for your time and attention.